I'm excited to introduce Dr. Staci Rogers, who is our new Chief Medical Officer and a member of our executive team. And let's start off. Dr. Rogers, welcome you.
Thank you.
And I want to hear more about your bio and your story and how you got to CMH.
Sure. So I am born and raised in the area, originally from Lebanon. I'm an OBGYN by training. I was at Cox Health for almost 18 years practicing and held various different leadership positions there, including as integration officer, transformation officer, and medical director for women's health. And really excited to be joining the CMH team as the CMO.
As we think about where we're going in the future and what our goals are, one of the things we discussed was just wanting to get physicians more involved in decision making, in the way that we provide care. I know that's something you're very passionate about.
Physicians are used to being in leadership roles, whether they realize it or not. They're the leaders of the care team. Where I feel like we have a great opportunity as we continue to grow as an organization is to also put physicians in some of those more formal leadership roles, making sure that they're working together with our nursing leaders, our operational leaders, and even our senior executive leaders to really bring that clinical perspective to all of the decisions that we make.
Talk to me about how you're using your time in these first days to start building and forming those relationships as you're new to CMH.
Really spending a good portion of my time just getting out and meeting our physicians and our APPs where they are, seeing our facilities, whether it's clinics, some of our long-term care facilities, the different departments within the hospital, and joining those groups where we have physicians or clinicians coming together to discuss issues and just understanding where they're at, where they see opportunities, where they may have challenges or pebbles in their shoe that we can start to elevate and work on solving together.
One of the things that I'm really impressed with is the culture of our medical staff, how that we're able to attract new quality physicians because the ones we have here are really good and really bought into the mission of CMH. Recruitment is really a key priority in our ability to grow as we recruit new physicians.
I think our biggest asset that we have to recruit new physicians to CMH are the physicians that we already have here. I have been so impressed by the depth and breadth of the specialties that we have, where they've trained, their own journeys and where they've practiced, and then how they've ended up here at CMH. So many of our physicians have said if they've been other places, yeah, I just wish I'd been here sooner. And that speaks volumes. I think the way that they collaborate amongst specialties is also really important, and I know that's been a big focus.
We want to make sure all the voices, all the people in the care team are valued, they're heard, and that we're working together to care for the patients. And I think that's going to be a key as we move forward and grow, to keep that personal touch that we have, not just between each other, but for the patient. Patients tell us that what they really appreciate about CMH is they can come here, they're not treated like a number, they're treated like a person, a family member. We want to keep that. I know right now you're doing a lot of level setting and getting your feet on the ground, meeting the people, but I think you've probably seen some things that are exciting, next steps for our future. And talk to me about what you think are maybe the next big priorities that we have, or what you're focused on.
Sure. So as I have been learning more about CMH, where we are, where we've been, and where we think we're going, we've seen a lot of growth. So I'm really excited to work with our care teams, both our physicians and our nursing teams, to figure out how we maybe do things a little bit better to accommodate that growth a little bit differently, but without losing the quality of care that we are known for providing.
I just want to let you know how much I appreciate you being a part of our team here at CMH. I know that you're going to be a great fit here. I'm excited about the experience you bring, and already I'm seeing the relationship you're building with our medical staff. I'm just so pleased that you've joined our team, and look forward to working together with you as we grow in the future.
Me too. Very excited to be here. Thanks.